Hi, I'm Terri Newman,
I'm Emily Ellsworth.
And I'm Brittany Spiller.
and we're going to talk about our shadow experiences. So, guys, who did you shadow, and what did you do?
I shadowed Dr. Meredith Howard at IU Methodist, and we went to the conference room there, and she discussed like what it was like to be a resident, and I was able to ask any questions that I had about residency life or being a pharmacist in general.
I shadowed Dr. Allie McIntyre at Eskenazi Health, where we spent the majority of our day in the oncology clinic, along with some inpatient experiences.
I had the chance to talk to Dr. Bhavni Parikh, and we spoke candidly in Starbucks about fellowships and life after graduation. So, what did you guys learn?
On my residency shadow, I learned that to do a residency, you don't necessarily have to go to mid-year. Mid-year is basically just a showcasing of the different residency programs. And if you want to do a residency in like Indianapolis area or someplace nearby, you can just go to the showcase in that area instead of traveling all the way to mid-year.
I learned that I would enjoy both the inpatient and outpatient roles of a clinical pharmacist. The inpatient role involved a lot of med recs and counseling on how to use medications and a lot of supportive care for nausea and vomiting and pain control for the oncology clinic. But the inpatient clinic involved rounding with the team and giving advice to the doctors and residents that were on the rotation.
I learned about the different types of fellowships and that no two fellowships are alike, and some fellowships give you different experiences. For example, Dr. Bhavni's fellowship is a regulatory affairs fellowship, and it's actually 2 years where most are 1 year. And hers actually involves teaching, and she actually spends some time in the hospital with Dr. Jordan. So I never thought that a fellowship could give you those types of experiences. So I learned to really do my research on the different types of fellowships, especially geared towards, what I think I want to do. So what are your guys' biggest tips that you can give?
Dr. McIntyre gave me 3 good tips to look for when choosing a program. She said to look for a program where the pharmacists are highly respected in the hospital. At Eskenazi Health, the pharmacists are very sought after for information on drugs and recommendations, and that was one of the parts that she really enjoyed there. Another tip is to try hard in every rotation that you go to, because word will travel fast if you don't. Whether you think that you will never be at that place again or you're not interested in a residency, put your best effort in and try your hardest, because someone will find out if you don't. And her last tip was to I don't know. I'll come back.
My resident told me basically the same thing as Emily, to put your best foot forward when you're going into these rotations, because these are the rotations that will prepare you for the future, and also you can utilize what you learn in these rotations to bring out in an interview if you're asked a question. And then also she said to get involved in projects that are going on, and that way you can have more like something to present when you're being interviewed or you have to present a case or something like that.
My fellow told me the same things as them. In addition, she said that don't be afraid to network. So you get on a rotation and you're like, I'll do it tomorrow. But you're only there for 4 weeks, and it goes by so quick. And especially in the industry, lots of the people that work there love the fact that you're a student. So if you just email them and say, hey, I want to meet and talk to you about what you do, they love that. So take advantage of the fact that you're a student and people know that you're willing to learn and to network. Also to do your research about the different companies. And then when you do go down to mid-year to interview, know that you're also there to see a company in an industry that will fit you. So know their company culture, because some places you interview for, you can't see yourself there. So pick something that will fit you.
Oh, and my last tip of advice that she gave me was to ask when you're on rotations if they know anyone in the residency, or if they know any heads of residency programs, because she said that she asked on run rotation and the person was like, oh, I roomed with the head of Eskenazi Health's department for residency. So that was how she got an in with the residency, and they talked to each other. So whenever you're on a rotation, just ask if they know anyone in a residency program, because it will help you get a foot in the door. Well, that's all we have today. That was our shadow experience.